bottom line is I just get paid a very small percentage of that savings. And if I don't deliver that 20% savings or $4 million on a $20 million budget, you get my fee back 100% guaranteed in writing. Free market healthcare. Have you heard that term before? And what the hell is that supposed to mean? Do you know what your healthcare costs? When you go in for a service at a healthcare facility, whatever that might be. But let's just say you need a knee replacement. Do you know if that knee replacement costs $30,000, $60,000? Did it cost $120,000? Could be, believe it or not. And something as simple as an x-ray. Have you ever gone in for an x-ray? And you think, gosh, I'd like to know what this costs really. And you ask the gal at the front desk, you know what? I've got an HSA, so, I'm going to try to pay for this with my health savings account. How much is the x-ray going to cost me? And she says, you know what? You'll have to talk to your healthcare provider. They don't even know what the cost of an x-ray is. Well, the truth of the matter is across the country here, employers are spending an average of almost $14,000 per employee per year on healthcare. And last year in 2023, it went up 6.5% on average across the country. So if you've got a 100-person company, that means at $14,000 per employee per year, you spent an average of about $1.4 million on healthcare, and you likely didn't get a thing back, not a dime. And if you're a company of 1,000 employees, that means $14 million. Now, you may or may not have recovered some of that cost because of the way you manage your plan, but likely not that much. And if it went up 6.5% like it did in 2023 for you, that means your healthcare plan went up from $14 million up $910,000 or almost $1 million in 1 year. That's garbage. My name's John Butler, and I sold my brokerage firm last year because I wanted to go completely independent. I managed that brokerage firm for the last 18 years, but I didn't want to be associating myself with any brokerage firm, any health insurance companies, certainly not any pharmacy companies. That's another story. But through that time, I've taken about the last decade to research and develop the marketplace all over the United States and found out that there are free market healthcare brokers at brokerage firms that are changing this thing for everyone around the country, and most don't even know about it. And actually, it was about 4 years ago, I got so angry that I decided to write this book to let everybody know just exactly how I feel about this crap. So when I found out that these free market brokers at brokerage firms around the United States are changing this thing, I asked the question, well, how much do they save? Well, most of them average, instead of $14,000 per employee per year, most of them average, believe it or not, between $6,000 and $8,000 per employee per year. Okay? And no matter what size company you have, 100,000, 10,000, you can do the math. You take that bogey down from 14,000 down to 8,000 per employee per year, and we're talking about some serious money. But how do you get to these people? I actually was involved in a program with 10,000 employees. I was kind of led along for about 2 years that they were going to give me their data and let me compare it in the marketplace. And then they finally said, you know what? We actually ran an RFP and we're okay. We're sticking with our current plan. Our 10,000 employee company was a $100 million budget, and they did nothing more than put in an HSA. I found out after the fact. So the RFPs can be difficult, or the request for proposals. Normally when a company does an RFP, they just got hit with this huge thing. I get 27% increase because the claims were bad and we needed to do something. So the C-suite barks down to the HR team and says, we need an RFP. Get some other people in here. But running an RFP, as I found out, it's not as easy as just running an RFP, as they say. Who do you put on the RFP? How much time and man hours does your team spend on running an RFP? Usually it's about 4 to 6 months on average, I found out. And is there a 5-star rating system on Google or anything out there that tells you just exactly who the best of the best are out there? Of course not. This is crazy. At my company, like I said, we've taken the last decade plus and designed a strategy to take the guesswork out of this mess. In 30 days, we'll run what I call a fast track RFP. You engage with our firm. All we ask is that you share your data from your healthcare from the last couple of years. We put it out there to bid for you, and we come back with an offer that is going to be pretty hard to refuse. What we'll do, instead of just guessing at the brokerage firms, this, that, and the other to compete against your current brokerage firm, we'll actually bring those warriors that I talked about, those free market healthcare warriors, to the table for you to decide who's best for your company. What they will do is they'll actually put a bid in the RFP and put their best foot forward to give me, your consultant, the best price that they can possibly offer. At the same time, I will come back to you and I will say, look, if you are running a plan with a $20 million budget, we will guarantee in writing at least 20% savings. Now, how do we do that? That's my business. The The bottom line is I just get paid a very small percentage of that savings. And if I don't deliver that 20% savings or $4 million on a $20 million budget, you get my fee back 100% guaranteed in writing. So what we want to try to do is to come to the table with 3 promises. The first promise is our analysis is completely free. You just have to be willing to share your data with us in a certain format that we need it so that I can bring it to these other people in the marketplace and compare what they can do for you. And every one of these is a little bit different. Number 2, we don't get paid unless we save you money. And like I said, we guarantee that savings in writing. And we also, number 3, put a zero deductible on every single solution. And that was the craziest part of my journey. By far the craziest part of my journey. How would you put a zero deductible after saving 20% or 30% on a company's healthcare plan? Well, this is actually a little bit easier than you might think. They've used technologies, they've used direct contracts, they've used relationships all around this country. And I'll take you back to that knee replacement for a second. Like I said, do you know if it's $30,000? Do you know if it's $60,000? Do you know if it's $120,000? These people actually do know exactly what these costs are at different facilities all around this great nation. And so if you have a knee replacement that you're looking at, they'll say, okay, well, you can use your regular healthcare system and pay a high deductible and an out-of-pocket cost and go to that $120,000 place to have your knee replacement done. But we've done the research in the background and we know the highest quality people, the 5-star rated facilities, are the ones that charge the least amount, or that $30,000. So in this particular case, they can take your healthcare plan and they can inform you that there's a place to go for $30,000 with the highest quality, the best outcomes of any other place. And if you go there, you pay zero. That's innovation. That's free market healthcare. That's what I'm talking about. I'm John Butler, and I really truly believe in the free market system. My nerdy heroes are Milton Friedman and Tom Solo, which I'm sure you don't know, but they are warriors for free markets. Choice and competition makes all the difference in the world when you're talking about healthcare. My fast track RFP will be done in 30 days for you if you engage with us. We'll make a guarantee in writing of at least 20% savings. If you want that zero deductible, we will have it on the proposal. You don't need to take it, but we're going to make a pretty darn good case for it because frankly, what I care about the most is the team members, your employees that are getting screwed on this thing every single day, every single month, every single year with these high out-of-pocket costs, these crazy deductibles, these crazy premiums, frankly, because you can bring those down considerably for them as well. But does a person want to work for your company with those high deductibles and those high out-of-pocket costs and the journey of, I don't really know what my healthcare costs are each year, but all I know is my boss comes back at the end of each year and says, yeah, it's going up another 4, another 8, another 18% because our claims were out of control. You need to get those claims under your control. So just click below if you're interested in learning more, get a 15-minute spot with me, and I'll look forward to seeing you on the other side. Thanks a lot.